Oh, Kim just joined us, I think.
Okay, so sorry for being late, folks. And Jenna, can you just start it out?
Yeah. Sure. Okay, are we ready? You want me to get started?
Yeah, I'm going to let you introduce yourself.
Okay, sounds good. So good morning, everyone. I'm Jenna Crawley. I'm the administrator for the Office on Aging and Independence here in Howard County. I've been here just under 2.5 years. And I really appreciate the opportunity to come and speak with you all this morning. So I have a presentation prepared. I'll share my screen. And if anyone has any questions, feel free. I'm not sure if I'll be able to see like the chat box while I'm doing this, but we can do questions at the end or as we're going. I'm fine whichever way you prefer. So I'm going to share my screen now. This worked when we did it on Friday.
Yeah.
Oh, here we go. I think it's not showing on my windows. I have a gazillion windows open.
Okay. So do you have PowerPoint open?
Yeah, I do.
Okay.
Why is it not?
So one way to find it is to close the other windows so you don't have so many to look at, because you get such a small icon when you do the screen share.
Yeah, no kidding. Okay, hang on a second. I'm sorry. This worked perfectly when we met.
Yeah. So because what it does is everything you have open on your computer shows as a choice.
All right, hang on. Oh, well, I could have been doing this while we were talking. Oh, here we go. Let's see. Ah, got it. The birds are certainly a nice background, Michael.
Yeah, I guess I need to mute.
Love it. Okay. Is everyone able to see my screen?
Yep.
Excellent. Okay, very good. Okay, so today's presentation is titled Healthy Aging, Office on Aging and Independence Resources. So just to give a little bit of a background about who we are and what we do, we are designated as the Area Agency on Aging for Howard County. So what that means is that we receive federal and state funding to really plan, coordinate, and deliver services that are specifically geared for older adults, persons 60 and older, persons with disabilities, and family members. Our mission is really simple, is to ensure that Howard County older adults and persons with disabilities have the resources that they need to grow, thrive, and live with dignity. And our vision is really to ensure that those services and resources are person-centered, that we have a robust community-based program, and that the resources that are available help to empower individuals as well as promote aging in place. We do advocate for persons who are underserved and potentially at risk for various reasons. So just to give a little bit of a background, given that we are cresting on the year anniversary of COVID-19 and having kind of had to revamp all of our services, I just wanted to reflect a little bit about where we were March 2020 and to where we are today. So, as you all know, older adults were identified as a high-risk population as it related to COVID-19, and if you were to become infected, to potentially have more adverse outcomes. So in March 2020, it was actually March 16th, so tomorrow is our year anniversary, where we basically had to quickly mobilize and take all of our operations remote. We certainly thought that we were only going to be gone for, a couple weeks, maybe a month or something like that. And here we are a year later, just now beginning to think about what our in-person services are going to look like. So over this past year, what we had to do was basically our teams, along with the community, began to learn new technology and platforms so that we can continue to deliver services and to continue to engage with each other. So our older adult priorities didn't change significantly during the pandemic. The biggest one was probably food access became really one of our top priorities, where we always provided nutrition and food resources as part of our Office on Aging. Really, food access became one of those primary priorities. So what happened with that is our congregate meals that were delivered at our 650 plus centers were shuttered as a result of COVID-19. And so March 16th was the last congregate meal we provided. As of March 26th, we stood up a whole grab and go meal program where we were able to deliver standard meal kits to individuals for both pickup and delivery, so that we were able to continue that service. Information and referral, we wanted to ensure that our community continued to receive and up-to-date information and resources, as well as assistance with navigating the service delivery system. That's something that we did pre-pandemic, something that we've done during the pandemic, and will continue to do afterwards. Advocacy is a huge priority, certainly during COVID, when individuals are living in long-term care facilities as well as assisted living facilities where families were not able to visit. Our ombudsmen were actively working to ensure that residents' rights were honored and that family members had access, whether it be phone, information, etc., but really advocating on the behalf of everyone who were in these facilities to ensure that those resident rights were honored. Also, as the Office on Aging and Independence, we are a Medicaid supports planning unit. And so we have a lot of community-based services for individuals who have lower income and need supportive services to remain in their homes. So our Medicaid supports planners twisted and turned and pivoted and did a lot of rewriting of treatment plans to ensure that services continued without disruption. So another tremendous piece, and I'm sure that you all have heard this throughout the pandemic and then just even prior to the pandemic, really about how important it is to remain socially connected and engaged. And so one of our primary priority areas is to decrease social isolation and to really think about strategies of how we can build upon that social connectedness, both on a micro level and also on a macro level. So just to highlight a little bit about some of the services that I've just kind of touched on just now, but as well as just to highlight those that I thought may be of interest to you all and those also in your community. So I touched on the grab and go meals. So the congregate meal program transformed to this grab and go meal distribution to include both pickup and delivery. We partnered with Neighbor Ride for those individuals who either weren't comfortable with coming and picking up or who just chose not to or were unable to do so. It's been a really tremendous partnership. To date, we have served over 87,000 meals in this past year. So if you really, just stop and think about that, it's pretty outstanding. And we also, in addition to standard meals that are provided through our vendor who is Meals on Wheels, we've also contracted with a Korean caterer. And so, as you know, we have a large Korean population here in Howard County, and we've been able to provide Korean meal kits as of August. And actually, we have more participants in our Korean meal kit program than we do our standard meal kit program. So it really demonstrates the interest that we have. If these are things that you all are interested in or know of somebody who could benefit from these services and resources, I'm happy to send you my slides following the program so that all of this contact information is included. And also, just of note, we've had over 800 unduplicated participants in the grab and go meal program. Of note, this is not a means tested program. It's open to anyone. We just ask for those who do participate if they are able to donate to the cost of the meal that they do. Otherwise, but you're not turned away if you don't. So this is kind of a fun thing that we've done, and we began this in November, and as you can see, St. Patrick's Day is our restaurant initiative for this month, and actually today is the pickup. What the restaurant initiative is that we've partnered with local restaurants and local businesses to provide festive catered meals to individuals who are 60 and older. The initiative has really helped to infuse our economy and support our local businesses. What we've done is we've used 40% of our CARES Act dollars that we received from the state to really help promote our restaurant initiative and to be able to use those dollars to serve dual purposes, like I just said. And we've also, it's been a nice offering just to be able to do something different and have meals, you know, that are available for individuals as they like, as well as to, you know, be able to highlight and promote some of these restaurants that are doing an amazing job through this pandemic and also just trying to survive. So it's been a great partnership. Our first meals were for Thanksgiving, and we partnered with the caterer putting on the Ritz. And then for Lunar New Year in February, we partnered with Hunan Manor in Colombia. Today, we're partnering with Kelsey's, and then April, we are working on that one. Our website is a great resource for information as to what the next restaurant initiative will be, as well as all the resources that I'm talking about today. And then also, we have a constant contact. So if you're interested in getting information about all of our offerings, we can talk about how to sign up for that. So Maryland Access Point. This is really like our one-stop shop for all things aging. It's staffed by information and referral specialists, and they are there to provide counseling on pretty much anything that may be of interest to you. Maryland Access Point, also known as MAP, we provide options counseling. So if you're considering a move, potentially, you know, from one community to a different type of setting, our information specialists can talk about that. They can also connect you to the various resources and services that we have in the community around caregiver support, food, long-term care, things of that nature, health insurance counseling. They have a lot of information. Our number is 410-313-1234. We like to say it's easy as 1, 2, 3, 4. And so really it's expert assistance navigating available community resources and the service delivery system. I highly recommend when you have a question, this is a great starting point. And Maryland Access Point, just of note, has really played an integral role in the pandemic and during the vaccine response. We actually have some of our MAP workers deployed to the health department currently to be able to help answer the hotline for older adults, because we know that we're specialists in this area and can really help facilitate people accessing the community, accessing the vaccine, and just providing information. So this is something that we've done pre-pandemic and will continue to do so. So our long-term care ombudsman program, some of you may have friends, family, relatives who are in long-term care, either in assisted living or also in a nursing facility. Our ombudsman program is part of the state ombudsman program through the Maryland Department on Aging. And our whole goal is to promote quality of care and quality of life in nursing homes and assisted living. So anyone can use our services, even if you have a question about long-term care and where to go and what to be considering. What our ombudsmen do is they are really those boots on the ground advocates, partnering with families, partnering with the facilities to ensure, back to, you know, kind of the health and welfare of residents and ensuring that residents' rights are honored. But also they work with the facilities and families to investigate and resolve complaints. So if there are concerns, the ombudsman is a really excellent resource who is impartial and can advocate and help to find a good solution for all who are involved. So our state health insurance program, and Jim, I think you're one of our volunteers, right?
Yes, I am.
Yep, that's what I thought. So you could speak better to this than I could probably, because you do this. But like Jim, we rely on really highly skilled volunteers to administer this program. And basically what it is, and it's not basic at all, it's actually very, very complex information that our Medicare counselors provide free of charge and unbiased, is our counselors provide unbiased assistance, helping people to understand Medicare, its complexities, prescription drug plans, Medicare Advantage health plans, claims, what can be billed, how to appeal, and also what's actually covered under Medicare. Our big time is during open enrollment when people are considering their various options and which pharmacy and prescription assistance plans to go with. And we rely heavily on our SHIP volunteers to provide that counseling. During COVID, it was really fantastic because what we did was that counseling previously had always been one-to-one in person. We were able to stand up our volunteer team with computers and programs, and they were able to deliver that service virtually and didn't miss a beat. And it's a pretty impressive resource that people can tap into, and probably we would love to see more people tapping into it, actually. Jim, is there anything that you would add?
Now, we really turned it around, and Aisha Takbe, who runs the SHIP program, deserves a lot of credit for this.
Yeah.
We were able to get the training in before that, even though it was like totally different doing it via computer. And it basically worked. There are a couple of people who weren't comfortable with computer work and they needed some follow-up, but I think we provided what we needed to.
Yeah, I agree wholeheartedly. It was, it's one of our success stories as it relates to the pandemic, but overall, our state health insurance program is just a tremendous resource for individuals of all income levels to really help navigate the complexities of health insurance and Medicare. They can also assist with applying for special needs assistance, depending on people's income, so that like the Part B premium is paid for and things like that. So just really terrific. And Jim, thank you for your service during this time.
Thanks.
So social isolation, I touched on that earlier. As you all are well aware, pre-pandemic, older adults were already at risk for social isolation due to a number of changes, such as sometimes with retirement, role changes, going from, being actively out and about to maybe now needing to be at home more due to caregiving, or just due to functional changes, not being able to get out as much as previously. And so some of those social networks start to limit a little bit. Negative ramifications of social isolation and low social connectivity have been equated to the risks of smoking 15 cigarettes a day. So we know that being connected and engaging in whatever meaningful ways that is for an individual is really, really important. And so what we've done as the Office on Aging and Independence, this has been one of our primary priorities, also pre-pandemic, but certainly became much more heightened and needed during the pandemic, when all of us were told to, socially distance, to limit our contact with people outside of our homes, etc. So what did we do to really kind of help increase social connectedness and decrease that sense of isolation? Well, we went for a low-tech option, and this is a telephonic support program. It didn't really kick off as much as we had hoped to. It's called Phone a Senior. It's really kind of a volunteer-based program where it provides peer-to-peer phone support. We plan to work on this some more, but we just really haven't seen it be as successful as some of our other options. But so we established a telephonic support program. Then really what our crown jewel has been as it relates to some of our efforts is the Virtual 50 Plus Center. And I've got to say, if you haven't checked this out, this is absolutely worth going and visiting. We have just a tremendous amount of services. We have exercise programs, wellness, do-it-yourself activities. We also have continuing education. There's a national park program that is offered on a regular basis, where we have park rangers from around the country who provide live presentations about their national parks. We have health promotion activities, where if you're interested in building new healthy habits and strategies, you can log into one of these offerings and begin building that repertoire. We have over 200 programs a month. So there is really literally something for everyone, whether it be informationally based, whether it be coffee hour with some of our 50 Plus Center members, depending on which one maybe you've gone to or you're interested in going to. And then we also have social and support groups. Mark, I heard you talking about a men's group. We have something very similar within our 50 Plus Center, where it's a core group of folks who gather on a regular basis and just, enjoy each other's company, talk about the latest topics, or have guest speakers, that kind of thing. Something that we also developed when we were in person, we had a monthly fitness pass at our Ellicott City 50 Plus Center, where you could participate in several fitness classes throughout the month for one fee. We developed something very similar, a virtual fitness pass with access to 26 classes a week for $50 a month. That breaks down to about a little over $1 a day for fitness classes that you can take, as scheduled. And I have another slide. So here's a little bit, just a picture of some of these classes that are offered. There's yoga, there's cardio and core, there's Pilates, strength, balance, circuit conditioning, etc. So a lot of really wonderful classes to be able to take advantage of and get fit at the same time. And that does work on a monthly basis. So something that, we also provide, and on a good day, caregivers are really quite the backbone to our to individuals who are experiencing functional or physical decline or even cognitive impairment. And what we have a national family caregiver program where we have grant dollars that we can provide to be able to offer respite and assistance, and that's not means tested. So I highly recommend connecting with our caregiver program manager, as well as we offer evidence-based programs. We're all about building skills, providing resources, and helping and empowering people to feel more capable and competent in whatever area they're looking to explore. And that's certainly relevant as it relates to our caregivers. So our Powerful Tools for Caregivers is a great evidence-based course that allows people to really reduce personal stress, communicate more effectively with providers, particularly as it relates to challenging situations, managing the stress of caregiving. It's often very difficult. And then also just kind of that whole idea of mutual aid, being in a space with other caregivers where you can share and learn from each other. So this one, we just wrapped up a Powerful Tools for Caregivers course, and we'll have another one that's scheduled for later in the spring. We invested in a new platform called True Alta, which is a web-based platform for caregivers to be able to log in, and there are skills building courses that people can participate in, and then you earn badges that help to really increase it might be how to care for someone who's bedbound, those kinds of things, those types of skills, how to advocate for yourself, those kinds of things. So that is also a resource that we have as it relates to our caregiver program. And then lastly, we have support groups, ongoing support groups for individuals who are caring for people who are living with dementia, as well as just caregiving as a whole. So switching gears, something that's really a top priority is promoting healthy aging and preventative techniques, and really thinking about what we can do to, help people age in a positive way and not be reactive to managing all of the chronic conditions, right? So what we have is we have a whole health promotions team that works on delivering evidence-based programs. One of these programs is called Living Well, and this is as well as in addition to the Living Well piece of chronic disease self-management, we also have falls prevention, living with chronic pain, and then also just what these focus on is really around goal setting, exercise, stress management, and healthy habits. We offer these programs in multiple languages, including English, Korean, and Spanish. We also have a diabetes course as well. So we partner with the hospital as well as the health department to deliver these programs throughout the community, some of which are included in our virtual 50+ center, and then others are community-based. Again, just on that same role of healthy habits, we have nutrition and exercise consultations that are available. We have free nutrition consults with a registered dietitian who will answer any questions about diet, nutrition, the impact of food on your health. There is no fee to participate in these, and they are 30-minute sessions. And then we also have an exercise specialist who will provide a one-on-one plan for you if you're looking to start or change an exercise program, and that is for a nominal fee of $15 for a 30-minute session. We are beginning to look at reopening one of our fitness centers at the Ellicott City 50+ Center, which is really encouraging, and where our goal date is mid-April to get back online with and in person for those services. More details about this is in our virtual 50+ Center e-blast. So our last resource that I really wanted to share with you today is our loan closet. And this is just an incredible resource that other counties do not have. And what it is a reuse program where we rehab durable medical equipment that's been donated, and then we lend it out to individuals, Howard County residents who are in need of it. We also have, if you can see in this left picture, we have all kinds of tools and devices that you can come to our loan closet, and try these things out to figure out what might be the best device to use that will be able to help support you, whether you have low vision, maybe low hearing, maybe difficulty reaching, those kinds of things. There is it's a showroom essentially, and these services are provided free of charge. We have experts who are on staff who are occupational therapists who can help problem solve and make recommendations based on the individual and unique needs that people have, as well as we also have an occupational therapist in another program called the Community Living Program that in pre-COVID times would go out and do home safety assessments and be able to make recommendations. Today, you were talking about toilets and the height of toilets, right? That's actually a real it's a real need, right? You know, like being able to push up and get off of the toilet becomes more challenging. And so having a toilet that's of higher height can be something that really makes a big difference from a safety perspective. It can help prevent falls. Many falls occur in the bathroom, as well as just from a comfort perspective. So our occupational therapists can help advise on what that height really is, specific to who you are and what your height is. So as well as we have raised toilet seats, bedside commodes, and just a whole variety of durable medical equipment that maybe you never even heard of, but that could be of use. So this is over in the King's Contrivance area. Right now we're closed to tours, so there is an option to be able to do virtual tours, but we are open for business, and you can contact our loan closet for more details, as well as the website if you are in need, or if you have equipment that you want to donate. We are loaning out equipment, have been since the early days of the pandemic. This is one of our programs that we saw a great need for and did not go 100% remote. Also of importance just to highlight here is that we have a number of partners. Equipment Connections for Children has pediatric durable medical equipment. So if you have grandchildren or you know of folks who maybe have a child who's in need of equipment, what happens is oftentimes kids outgrow that equipment very quickly, and insurance will not always pay for things as the child is growing. It's kind of, you can get it at one time, but like you can't have a walker and a stroller at the same time for a child. And so Equipment Connections for Children helps to fill those gaps. We also have Maryland Technology Services, and that's some of what you're seeing over here in the left-hand picture of all of those various devices. We're very fortunate to have that site because otherwise you'd have to go to the other side of Baltimore to their showroom. And then we have all of that information here located in Howard County, and they too can make recommendations. And then lastly, we have Rebuilding Together, which is just a really tremendous nonprofit here in the county that helps low income and moderate income homeowners with home repairs and home modifications. And they are based out of our loan closet as well. So that is all I have in terms of highlighting some of the resources. We have many, many more resources that I could go into. But just in closing, want to share, that we remain available during this time. We have been available, we'll continue to be available. We're ready to serve. And we serve in a lot of different capacities, as you can see, from a recreational perspective to a health promotions perspective, to advocacy, and in even providing food. We do a lot of direct service, and that our goals continue to be to share out information, to outreach to communities where we've not impacted previously, as well as to reconnect with those who we have. We want to facilitate connections and create engagement opportunities. Ultimately, we want to provide the right resources at the right time. And so to learn more information about us, we do have a Facebook page that's located here. We have our website, and something that I didn't mention, but that's worth mentioning, is we have a whole age-friendly initiative that is about 1.5 years in. And what that is really about is creating a more livable, age-friendly community. And we do have the website here. We are in the final stages of writing our action plan that we're going to submit to the county executive for approval by May. And what you'll see out of that is a number of recommendations to really be able to promote a more livable community for all ages. So with that, I thank you. I am happy to answer any questions that you may have, and I'll stop sharing my screen so I can see all of you.
I have a question I'd like to ask. Can you hear me
Sure.
okay?
Yeah.
You had mentioned that one of the Howard County gyms, the one in Ellicott City, was getting ready to open.
Yeah.
We have a gym in our clubhouse that's obviously been closed since the beginning of the pandemic, and we're looking at ways to possibly open. Where is the best place for me to get a set of protocols or safety protocols for the gym opening that we can take a look at?
Okay. I can share some of ours. What we have done is, research best practices. We've looked at what our Recreation and Parks Department has done because they've been open long before we have. And then the Columbia Association actually has a tremendous amount of resources on their website that they developed, also based in best practices. And I believe they have a whole manual or PowerPoint.
I did look
Okay.
at it a little while ago. Yeah.
That one's good. So what also we consider is the square footage of our fitness center based on what the capacity guidelines are, and with the governor lifting many of these capacity guidelines, as well as, I think just recently, like a week ago Friday, if I recall correctly, gyms are allowed to be open now, and if it's not at full capacity, it's pretty close. What we are doing is we're scheduling appointments and limiting the number of people who can be in our fitness center at once, and they do have to be pre-registered to come on board, and that's our start. But Mark, I'm happy to get information to you about our protocols.
Okay, great.
Do you have an email address?
You can send them to Christy or Carol, and they'll get them to me.
Okay.
Thank you.
Thank you.
Sure.
With the size of our facility, though, it's going to be hard getting more than 2 people in at the same time.
It's very limited. Ours is limited to, ours is small. 50 plus, Ellicott City 50 plus Center is our largest fitness center, but even then, I think the max that we'll be able to have is about 4 people.
Yeah.
It's small.
And are you going to require masks?
Yes. Yep. Masks will be required. Patrons will need to wipe
Mhm.
down.
Will you require vaccinations?
We won't require vaccinations,
Mhm.
but we will require masks.
Thank you.
Jenna, thank you for the presentation. If you'll email your PowerPoint to me, I'll get that posted so the residents that join can see the PowerPoint. And Mark, thank you for the recommendation about recording. I've recorded the presentation, which I'm going to stop now. And I'll post that and make that a link to that available to residents that weren't able to attend.
Jen, can I ask you something?
Sure.
What time are your gyms open to? What time do they open? What time do they close?
Yeah, so typically speaking, we're open 9 to 4:30. Pre-pandemic, we had evening hours, but we're going to, it's basically going to be 9 to 4. Will be our hours.
With no evening hours, none.
No evening hours yet.
Yeah, okay, that's good to know.
Yeah.
That's good to
And
know. Yeah.
Yeah, and that's more based on our staffing. That's, you know, and if your
Exactly.
fitness centers aren't staffed, it's different, but it's based on our staffing.
Right, yeah, same over here.
Well,
Yeah.
we would probably have to do it just when Carol and Christy were there. Yeah.
Yeah, yeah. It's encouraging to be thinking about being able to open. And I certainly think with more vaccine available and just while we're, you know, before we started this call, you know, people sharing who's been vaccinated, where we are in the process and things like that. You know, I certainly, I think that we'll see more people coming back as they are vaccinated, and the access to vaccine seems improved. We still have a ways to go, but people are being able to get it. So something that we're doing that I didn't mention is we are working with independent living senior facilities. So mostly low to moderate income apartment buildings, but the Office on Aging has been standing up vaccine clinics at these locations since mid-March. Oh, excuse me, we're in mid-March. So since mid-February. And we've been responsible for helping to vaccinate over 300 people at this point. And going to these places where there's been transportation issues, limited English proficiency, and just functional decline, where it would be very difficult to navigate kind of the bigger vaccine sites. So that's an ongoing effort that we've been a part of with our mobile integrated community health team through the Department of Fire and Rescue Services and Health Department.
Thank you. Thank you.
Yeah.
If no, I'm sorry to monopolize this, but if no one else has any other questions, I have a couple more if you don't mind.
Sure, I don't mind.
Okay. When you open the 50+ centers, I assume there'll be limited amounts, but I assume you also will not require proof of vaccination.
No.
To come in.
It's a HIPAA thing, you know.
I'm sorry?
It's a HIPAA thing, you know,
Well,
in
that's what I was
terms
going
of.
to ask you, if it was age discrimination, or, you know, have you've checked with your attorneys and have said you can't do it?
I mean, that's not even been a point of discussion, because I mean, really it's the idea of if people are using universal precautions. So if we're following kind of mask wearing, washing our hands, social distancing, because that will still be required, then the risk is lower. So it's not, you know, it's not without risk. Where the lawyers come in is new consents, right? You know, basically kind of that people will sign saying that they understand, like by participating in these programs.
They will have to sign waivers or something.
Yes.
Yeah. Okay.
Yeah.
And the final question I can think of is, several of us have been discussing the so-called the UV cleaners that some people have put into their air conditioning system. Have you all looked at that, or have you done it?
That is not, so I'm going to defer that question. We have a whole facilities department that looks at our ventilation systems, HVAC systems, things like that. So I can't speak to that. Okay. I do know from a UV perspective, like we were talking about at the loan closet, we have a hub scrub that we do that with. We use UV treatments to sanitize all of that equipment before we, you know, redistribute it.
Mhm.
So we use it in other ways, but I can't speak to the ventilation systems.
Thank you very much.
Sure.
Very, very helpful today. Thank you. We appreciate it. Thank you.
Yeah. Well, thank you. Well, so let me ask, if I may, from the participants, have you engaged with the Office on Aging previously? And was this information that you're aware of, or was anything new? And then my last question would be, what could we do that we're not?
Well, I don't recall any outreach to or from the Office on Aging, and I was glad, I forgot the name of our resident that suggested you as a speaker. I'm glad that she did. And to help continue the outreach, I'll do a little summary of your presentation as an article for our community's quarterly newsletter.
Oh, great.
For the benefit of those that don't like or aren't able to download the presentation or the PowerPoint.
Okay. And if you want more information, like thinking about the folks who live in your community and would be of interest to them, so like SHIP, the state health insurance program, if you would like for them to do a presentation, because they will give you a whole lot more detail. Like I just gave an overview of here are our programs. Aisha Takbe, our program manager, is so passionate about health insurance and really is a great wealth of information. And if that would be something that would be of interest to the folks who live at Snowden Overlook, we could certainly, do something very similar to this and just provide a much more deeper dive into what that program is and maybe, how folks can access it. So, if there's things like that that I touched on that you think would be good, please let us know.
Thank you.
Thank you again. That was terrific.
Good, thank you.
Thank you for your time, Jenna. We appreciate it.
Yeah, absolutely. Thank you, Christy.
Thank you.
Okay, thanks again. And remember to send me the PowerPoint and I'll send you links when we get it uploaded to the website. Thanks.
Excellent. Thanks very much.
Great.
Take care.
Bye, everybody.
Have a great day.
Thank you.
Bye.
Great day. Appreciate it.
Okay, bye-bye, and sorry I was late.